What do you want to say about medications, the classic medications that people get prescribed on? Maybe a lot of people that are listening today are listening to this podcast because they're on a medication. Where should really people be wary of these medications?
Yeah, and it's a really important point because, again, kind of going back to how does our medical system work? How much time does a doctor have? What are they going to dig in on with people? And so very, very frequently, people go to their doctor's office. They say they have trouble sleeping and they're prescribed a sleeping pill because that's the quickest thing to do, the easiest thing to do. It takes a minute or two. And then, hey, what's the next thing you want to talk about? Okay, thank you very much. So people are sent home with commonly, Ambien, Lunesta, Sonata, and these are not safe medicines. They can be helpful. But we've all heard stories of people having weird stuff happen to them, right? They've taken Ambien and they didn't get in bed quick enough. And before they know it, they're like driving around, doing crazy stuff and not having zero recollection of it the next day,
Wow.
right? So that's one small aspect. But beyond that, there's studies showing that there's increased risk of cancer and increased risk of mortality with even not very regular use of these medicines. And beyond those risks, they're not really helping us sleep. They're mostly just kind of turning off the being awake. And so they're not helping us get into the proper sleep stages and get the benefits that we need to from sleep. And so we do use sleep medications when we need to. But we'll frequently reach for, sort of off-label uses of things like gabapentin. So 1 to 300 milligrams of gabapentin can be quite helpful. Low doses of something like Trazodone, or even an alpha-blocking medicine called Clonidine. Clonidine is particularly helpful for people who have that experience of, it's 8 o'clock and instead of getting more sleepy, they are waking up. They're like, I'm ready to go. Like I'm like jazzed and energetic and a little revved up. And so that's an alpha adrenergic state. And so that medicine can be helpful. It's not without potential side effects. It's also potentially a blood pressure lowering drug. And so as we're working with the dosing, if we're using that, we tell them, hey, be careful if you're getting out of bed in the middle of the night, sit up, stay there for a few seconds, 15, 30 seconds, make sure you're not dizzy, get up slowly kind of thing until we find the right dose. But the thing I like about that, and this is what we do a lot in our practice, we always reach for the lifestyle and the natural remedies first, but we're not shy about using prescriptions, right? I think that's the beauty of functional medicine, integrative medicine, is the integration of these different sides. But we're also frequently not using the mainstream medicines. We're using sort of a repurposing or a creative use of other more safe medicines. And I think that's where a lot of the nuance happens.